think about what all the variables are that you have at your disposal to be healthy. There's basically 5 as far as I can tell, maybe a 6th. So what you eat, your exercise habits, your sleep habits, how you manage emotional health and stress, what drugs, supplements, hormones you take, and then kind of call it the grab bag, like sauna, avoiding air pollution, like all the other stuff that you could do that can have a positive impact on your health.
And what's interesting, too, about the emotional health is it's very much tied to isolation. Like, people that are isolated, that's a gigantic issue. People that don't have good friends and people that are sad and alone. What is the statistic on that? Isn't it something like
if you're
50?
single, if you have a higher mortality if you're not in a relationship, for sure.
But it's higher. It's as high as it's more high than people that are alcoholics, and it's more high than people who smoke 15 cigarettes a day.
Yeah, there's probably some break off point. Yeah, there's some break off. Yeah,
but isn't that fascinating that we are such social creatures that your actual physical vitality depends upon your interaction with other human beings.
Yeah, look, I mean, none of us, not one of us, could survive in the wilderness indefinitely.
No,
and that's, part of that, I think, is obviously the physical part of that, but I think emotionally as well.
Yeah. Well, that's one of the reasons why we're so terrified about those people that decide to do that. Like, when you get a Ted Kaczynski who's out there in a fucking shack in the middle of Montana, those people are terrifying because there's something so wrong with them that they want to be alone.
Yeah. So go back to those 6 things I talked about, right, or whatever. How many of those did we learn in medicine?
1.
Just the drug bucket. And by the way, we didn't even learn that bucket fully because we didn't learn anything about hormones. We didn't learn anything about supplements. We basically learned the drug bucket.
Yeah.
And that's not an exaggeration. I mean, I literally had 0 education in nutrition, 0 education in exercise. So even if a doctor knows the literature, which says, okay, stuff you and I have talked about many times before, if your VO2 max is this, it's 3 times, more beneficial to your lifespan than not smoking is. All that kind of stuff. Even if they knew that fact, they don't know how to tell you to train.
Right.
Like, they don't know what workout to tell you to do. And yes, a good doctor should know that you're better off being a normal weight than being overweight. But if you actually ask them, what should I eat? How should I achieve this goal? Eat less, exercise more. Yeah, I get that. But give me more specificity. Like, tell me what to do.
Yeah.
They can't.
Yeah, they can't.
And again, they're in a system where, let's just say the average doctor might get, 10 to 15 minutes with a patient a day.
Yeah, and then they're constantly cycling new people. And, they have to pay insurance and they have to pay the lease on the building they're at. They're probably still in debt from their medical bills.
Sure, and they
education.
basically have to hit certain billing codes to get paid. And the billing codes include diagnosis, right?
Yeah.
You only get paid when you can say, this is the problem, this is the problem, this is the problem. So, I don't know. That's why I think, like, this is one of those problems where I think you have to sort of take individual responsibility at this point. I don't think you can wait for the system to fix itself.
You certainly have to take individual responsibility, but there's so many people that don't even know what that means. For you and I, as people who have concentrated on health most of our lives, that's, we kind of have an understanding of the territory. There's a lot of people out there that literally don't know where to begin. And so it's such a daunting thing. They're intimidated. They don't know how to start. They don't understand the benefit of it. I mean, there's so many people that are intelligent people that I know. They're intelligent. They're very smart. Their body is a fucking trash bag of disaster. Like, how are you existing like this? You can't be really happy with this body. Like, it's not with the way it looks.
No, I understand.
What I mean is,
how
like,
you feel.
Functioning. There's no way. There's no way it functions well. It's like you have sugar in your gas tank, man. Like, you're fucked. This is not good. And yet they don't even think about it. They're just going through life.
Yeah. But again, I think when I say personal responsibility, I don't mean what I mean is the system will not fix that problem.
The system will not fix
that problem.
One of the great benefits of the time that we live in today is that someone could read your book or listen to your podcast or Huberman or, many of these people
Yeah,
that have these really, really educational shows that can, Huberman's fucking all this list of different topics that he covers. We went over it when he was here last week.
Yeah.
It's like, what a resource. What a great thing to be able to have something like that.